Okay, now to the vital signs tab. Again, just like the patient assessment, tap add to capture your vital signs. Again, making sure your times are correct and your date is correct as to when they were taken, especially if you cross over midnight for the night shift folks. So it's going to have time prior to arrival, yes or no. So this would be if you arrived on scene and first responders gave you vital sign information that you want to record. You can click yes. Who performed it? There's a list of all the employees' names are in here, as well as first responder, EMT, paramedic. Try to be as specific as you can, because again, these are important, especially if you end up with legal action taking place with this run. Very important to know who did things. Blood pressure method is palpated, auscultated, or non-invasive blood pressure machine, which would be our monitors, for example. The actual blood pressure, so again, you can use your keyboard, you can use these tabs, or these numbers on the keypad here, and you can just click down through this. Pulse is 104. Regularity of the pulse, strength of the pulse, respiratory rate. I'm just going to click down through some of this. You have the respiratory regularity, respiratory effort, pulse oximetry. Lets you choose, is it room air or supplemental oxygen. Untitled CO2 is listed. Capillary refill, blood glucose level, Glasgow Coma scale. With these, you just have to choose for each of the three categories: eyes, verbal, and motor. You just have to choose what they were, and it totals it up for you. If you make a mistake, you can go back and retotal it, and it goes through like that. When you click through, it enters that information. Cardiac rhythm interpretation, any ectopics on the monitor, your lung sounds, right and left, stroke scale, lists the Cincinnati stroke scale, the LA stroke scale. We prefer the Cincinnati stroke scale simply because it is a little quicker and a little bit easier to do and gives you a good deal of information. You can click through this and you have your neurological assessment, pupil size. Again, you just click on whatever they were, and it totals all that information up for you. Pain scale, skin color, skin temperature, skin moisture, and that sort of thing. Again, down the left side, you have different tabs. You have trauma scores, for example. You have the APGAR score if you have a newborn. For burns, we have the rule of nines, and so it will automatically calculate that up for you. So if you have the upper back, I think on this one we had the upper left leg, so you click on that, and again, click on the most appropriate thing. And if these don't apply, if it's a partial of these things, then you can just put that in your narrative, put that in the comments to the assessment or wherever. There are comments here, so you can have a free typing text area. This is where you can say, for example, it was just a lower part of the abdomen, the front part of the upper leg, and that sort of thing. Medical devices is where you can upload and transmit your 12 leads and upload your data. So if you had, and I don't have a monitor here hooked up to it, but you would click on upload. You would look at the Zoll X series, click on Wi-Fi, and it would need to pick up a Wi-Fi signal. So that's how you upload your data, and that's all we have for this one.